Good morning, I am Jennifer Taylor. Today we're going to talk about a not so attractive topic, intestinal parasites. Intestinal parasites are one-cell organisms, or intestinal worms, that live in the small or large intestines and use the stool or blood from the intestinal wall as a source of food. The female can lay up to 10,000 to 25,000 eggs per day in the intestines of a person. On a daily basis, one could experience symptoms such as diarrhea, constipation, or allergies. Combine them with other simple symptoms such as constipation, irritable bowel syndrome, or skin conditions, and they may be suffering with intestinal parasites. More serious symptoms such as tumors, chronic fatigue, and immune dysfunction can also develop because of intestinal parasites if not treated correctly, or if a person has a low immune system due to being on chemotherapy. In these rare cases, the infections could be fatal. People with small cases may not experience symptoms at all. If a person thinks they may have intestinal parasites, there are two different ways of checking with a doctor and determining whether they do have the intestinal parasite or not. One of the main things they do is taking 3 stool samples. These have to be taken every other day in order to get an accurate reading. For more serious cases, a blood or biopsy can also be done. Most of the time, a patient can treat themselves at home, and there are many different types of treatments that can be given. Paromomycin is a safe one because women can take it even while pregnant. If a person has the serious symptoms that we had talked about before, they must be treated at the hospital. Otherwise, they can be treated at home. How does one contract intestinal parasites, you may ask? We are many different places they can be contracted. They can be contracted through animals, through food, through sex, and through water. With animals, they can be contracted with just by going to your local petting zoo or pet shop and handling the dogs. If they have intestinal parasites, it can get into your system. Also, just your pet being outside, playing in the dirt and the mud, and bringing it inside to your home. And also his waste, whenever cleaning up after him. Intestinal parasites can also get into your system. In the case of food, make sure your food is cooked thoroughly before eating it. In most cases, the worms and bacteria have not been thoroughly killed, if not cooked. In the process of eating raw meat or slightly undercooked food, you can get intestinal parasites. Also, raw vegetables, raw food, and fruits must be washed thoroughly before consuming, because in these cases they can also have the bacteria or the parasite. When engaging in anal sex, make sure to wear a condom, because in this cases it can be transferred from one person to another. Only in the cases when vaginal and oral sex follow anal sex can the parasite be transferred to your partner. Otherwise, you are safe. According to the National Library of Medicine, contaminated water can also contract intestinal parasites. Children are most likely to get intestinal parasites because of playing outdoors, bringing the dirt underneath their fingernails, putting their hands in their mouth, and biting their fingernails. All of that ingested can bring intestinal parasites. Approximately 1/3 of the world's population is infected with the illness, and most of the time it is in developing countries. In the United States, it is third overall in developing in illnesses and diseases. When we look at our own state, Louisiana, we determined that children newborn to 5 are the highest to contract intestinal parasites. Once again, by putting their hands in their mouths while playing in the dirt or biting their fingernails. Or even a spoiled diaper can also give a baby intestinal parasites. As of 2010, there are usually 150 to 200 cases of the parasites reported in Louisiana. In Lafayette Parish, the average 2.9% of 31 cases are reported yearly. The main thing to remember, intestinal parasites, is good hygiene. Always wash your hands after using the restroom, changing your babies, or picking up after your pet. Doctors also recommend, when traveling, drinking, and brushing your teeth with bottled water. Use a condom when engaging in anal sex. Avoid swimming in creeks, rivers, and lakes. These are just a few tips to prevent intestinal parasites. For more information, you can visit www.parasites-cleanse.com or www.ehow.com or any of these other websites listed in any of the references. Remember, with any viruses, they can be treated and cured, but they can also be prevented.